Hi everyone, this is our second video blog for the counseling class, and we are going to discuss the basic counseling skills and characteristics of a counselor. There are 4 questions that we need to address. The first is, are the sessions you watch similar to what you imagined a counseling session to be within the videos? My answer to this is yes and no. In a typical therapeutic session where it's the counselor and the client, and in an isolated situation, yes, very much what a counseling session would look like. However, I've witnessed counseling on the front lines in Afghanistan and Iraq, which is extremely different. I've witnessed counseling on the front lines with law enforcement and firefighters dealing with signs and symptoms and situations that most normal people don't go through. The therapeutic sessions with marriage and family therapy are very different than what we've seen in the video, as well as inpatient care. Inpatient therapy is entirely different from what we've seen in the video. You may have that in inpatient care, but you also could be counseling somebody that's having an emotional breakdown in the middle of a corridor. So counselors have to know that it's not always going to be a quiet, isolated therapeutic room, even though that is planned. But I've seen counseling sessions appear in different types of situations. The second question is, from your readings in Chapter 8, what skills and counselor characteristics did you notice? Open-ended questions, encouragers, a lot of them paraphrased, reflection and feeling, especially the third video. The third counselor definitely used reflection and feeling, reflection of meaning as well. In the third video, the second video paraphrased and encouraged her client a lot more. The first video had a lot of open-ended questions for the individual. What differences and similarities did I note between the 3 counselors? They all paid really close attention to their clients. They checked for understanding to make sure that they were basically addressing the needs of the client that had come in for therapy. They all used attentive silence very well. And they used a good source of the counseling skills throughout all 3 videos. The fourth question is, what questions do you have about counseling? Because I've witnessed marriage and family therapy, I've witnessed pastoral counseling on the front lines and not on the front lines. My question is what type of attitude and what type of counseling skills do you like to use in a non-therapeutic session where it's just the counselor and the client? How do you know what skills to use, basically, in different types of situations? Thank you very much and have a great day.